Hi, my name's Kylie Martin. This is my healthcare disparities project. I chose to do it on inequitable access to care. I know it's kind of a broad topic, so I decided to narrow it down to two main subtopics. And that will be medical deserts as well as health professional shortage areas. So just to define those really quickly, a health professional shortage area is a geographic area, a population or facility where there's a shortage of primary, dental, or mental health care providers. And this is determined, this is just the United States and determined by the Health Resources and Service Administration. So that's just determined by a specific organization. And then a medical desert is any populated region that would take more than 60 minutes to get to the nearest acute care hospital. Okay, so health professional shortage areas first. So summarizing the research that I did on health professional shortage areas, they all kind of touch base on the social determinants of health, including poverty, demographic factors, economic and social factors as well. The bottom line is rural areas experience significantly higher rates of poverty when compared with their urban counter. And research has indicated that a higher per population density of primary care physicians is a strong predictor of better health outcomes across a number of different aspects and domains. So we might have already touched on kind of the types. So there are primary medical health professional shortage areas, dental and mental health professional shortage areas. And it's just determined by the number of health professionals relative to the population in that area. And here's a map. I thought it was interesting to see, this is by county. There are hardly any counties where none of the county is a shortage area. Most of them have at least part of the county a shortage area. The Health Resources and Services Administration is the organization that is kind of, they name the health professional shortage areas, and they have a number of programs trying to serve and mitigate those disparities. NHSC is one of those, Nurse Corps, loan repayment. But their four main overarching goals is to improve access to quality care and services, improve the health workforce, improve healthy communities, and fourth, improve health equity. We can see from this graph that the all-cause mortality rate, I know it's a little outdated, it ended in 2015, but it's just always been higher in rural communities compared to urban communities. Now moving on to healthcare deserts. So we talked about how that's a populated region more than 60 minutes away from the nearest acute care hospital. Kind of the bottom line of research with medical deserts is similar in that there are barriers to mental health, behavioral health, obstetric health that we don't see in more urban populated areas. We also see more apparent gaps in childbearing age, people having children much younger. And this is related to access to birth control, abortion, and OBGYN healthcare in general. There's an article in here that researches the proportion of rural America that's medical underserved, and they found, referring to a Washington Post survey, that nearly 80% of rural America is medically underserved. So 80% is quite a bit. That's the vast majority of rural communities are medically underserved. So, and last but not least, I wanted to relate this to childbearing, as we're in a childbearing course. We touched on how gaps in the age of childbirth is much wider between urban and rural populations. The main points I took away from the articles I read is there significantly higher risk of low birth weight and preterm birth in health professional shortage areas and medical deserts. The infant mortality rate is more than double the national rate in rural areas as compared to more populated areas. And there's an increased likelihood of unintended pregnancy in those living in small towns or rural areas. The article I read about from the American College of Obstetricians and Gynecologists also emphasized the fact that many childbearing people there's a higher level of medical mistrust. And so they're often finding that people from rural communities will travel farther distances for better health care or forego the health care because it's difficult to access or the cost doesn't outweigh the benefit for them in their minds. Yeah. So here are the references for the articles I read. I especially recommend that top one from the American College of Obstetrics and Gynecology. But they were all great and very enlightening. And the best part is solutions or results at the bottom where they offer propositions to help kind of improve health equity and work on these barriers to health that we find in rural communities.